Myself, Dr. Amit Aiwale, consultant, brain and spine neurosurgeon, Solaris Hospital, Thane. So today we are discussing about epilepsy and seizures. So there is many patients, they are always confused what is epilepsy and what is seizures. So epilepsy is continuous one or more seizures occurring 24 hours apart in a patient with unprovoked seizures. And a seizure is an episode which is due to the abnormal electrical activity into the brain. Once the epilepsy is diagnosed, what are the precautions you need to carry? So epilepsy can occur recurrent if the medications are not taken properly. So do follow your doctor's prescriptions properly. You need to take a good sleep disturbance. You should not do the long fastings. Even fasting and decrease in the glucose levels can aggravate the seizures. Then you should avoid driving immediately, because during the driving, if you get a seizure, there is a chances of having accidents. And avoid any strenuous or activity which may aggravate the seizures. Then when you see a patient with active seizures, you should try and take the patient to a safe area. If he is on chair, make him lie down. If he is on bed high, try to see that the corners are supported. Try to see and wait that his airway is safe, putting him in the lateral position and he does not have any aspiration or vomiting. And then if at all you have the facilities, you can use a sedative nasal sprays of midazolam which are available with the patients. And once the seizures are stopped, as early as possible, take him to the nearest casualty home. Then seizures patient definitely can have a normal life. It does not affect your daily routine. You can get a good family life. You can have a children's. Only difference, I would say, if you are planning any pregnancy after the seizures activity or the epilepsy, you should consult your neurologist or the neurosurgeon and try to shift onto the medications which are safe during the pregnancy. So there are few drugs which are more safer in the pregnancy, and we can shift those drugs and have a safe pregnancy and a childbirth. Then again, the patients, they complain that they are not very comfortable with few medicines, or I am not able to take doses, multiple doses. So now a newer drugs which are available, which are sustained release, or drugs which are able to get appropriate blood concentration in shorter period of time and have a good results, or the seizure control, are available. In few patients where drug resistant are the patients who are on multiple anti-epileptic drugs and they have disturbed quality of life, can get evaluated for possibility of epilepsy surgery. So this epilepsy surgery, these are now very safe after the proper evaluation, which a combined team approach where neurologist, neurosurgeon, psychologist evaluate the patient, get all the reports, semiology, study the semiology, and plan according to the patient's needs. And these surgeries are now very safe with the advanced treatment options available. So these options also can be taken by the patient. Thank you.